Welcome to the Caregiver Relief Podcast, where we shine a light on the challenges and solutions facing today's family caregivers. I'm your host, Diane Carbo, a registered nurse with over 50 years of experience helping families navigate the aging journey. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Today's episode is a critical one. We're talking about strokes, what they are, how to recognize them, and most importantly, how to prevent them. I'm joined by the incredible Rosa Hart, BSN RN, and a nurse stroke certified RN. She's a speaker, a podcaster, and not-for-profit founder. Rosa brings years of experience in working directly with stroke survivors and their families, and she's here to help us all better understand the signs, the science, and the steps we can take to protect our brains. Whether you're a caregiver, a healthcare professional, or someone concerned about stroke risk, this conversation is one you won't want to miss. Rosa, thanks for joining me today. I know you've had a very long day and it's the end of the day, and I'm really appreciative of you taking your time to share this information. So let's start with the basics. What exactly is a stroke and how does it affect the brain?
Sure. And thank you, Diane, for having me. It's an honor, and I'm just so happy to be here and talk to caregivers. You and I have been caregivers, and we get to go home at the end of the day a lot of the times, and some people don't get to do that because that's their life. So
yes,
I'm more than happy to do anything I can to support that, whether it's through education or identifying available resources. The first question was about what stroke is, right?
Yeah.
So there are two kinds of stroke. There's ischemic, which is caused by a clot or a blockage of blood flow, preventing blood flow. Then there's hemorrhagic stroke, which could be a bleed in the brain. And sometimes blood can be in the brain because of an injury, and that's not technically a hemorrhagic stroke. Hemorrhagic strokes are usually caused without an injury, so that's a differentiation. About 90% of strokes, I believe, are ischemic. So that's what we'll spend most of our time talking about. But the number one thing you can do to prevent either is manage blood pressure and keep it under 130/80.
That's one of the things that people don't understand, that it is preventable.
Yeah.
So what are some of the most common risk factors for stroke, and which ones are preventable?
Because some things are preventable or modifiable and some things are not. Like, you can't help your genetics necessarily. If you're born with anatomy that is structured differently, that makes things harder, that you can't control that necessarily. But things that we can control are blood pressure and cholesterol or obesity, or smoking or other use of nicotine-like products, use of alcohol, activity level, and diabetes is a really big one.
I didn't know that.
Yeah, so if you are diabetic, you're twice as likely to have a stroke no matter what your other risk factors are.
Wow.
That when your body is outside of homeostasis, it's stressing all of your body and all related. And I was talking to an endocrinologist the other day, and like one of the telltale signs that you might be trending towards diabetes is having an elevated blood pressure. because when something is going wrong in your body, the other parts of your body try to compensate. It really is all connected.
So most people don't recognize the early warning signs. What are some symptoms people and even caregivers should watch for?
You said early warning signs, and I want to be clear that the telltale signs of stroke are sudden.
Okay.
When things come on gradually, then that can be caused by something usually that's not a stroke.
Right.
Stroke-like symptoms can be caused by mimics, like a sudden drop in blood sugar can cause some stroke-like symptoms. But it wasn't that sudden. You can feel it coming on, for example. We use B FAST to know the signs of stroke, and B is for balance, a sudden change in balance. You might be a little wobbly all the time, so this would be a sudden change from whatever your normal is.
Yes.
Then E is for eyes, a sudden change in vision. It could be loss of peripheral vision. It could be blurred vision. It could be double vision. And something with these is a lot of the times the person having the stroke and showing these symptoms is not aware. They have something called agnosia, which is they don't know it's happening.
Yep.
So it's really important for us to all know the signs of stroke so we can recognize it in other people. So if you notice someone is acting like they can't see something that normally they would be able to see, they may not be aware of the change. So it's up to us to pick up on that.
I worked at Sister Kenny Institute in Minneapolis, worked with many stroke victims, and I was young in those days and in my 30s. And my mother-in-law was an older woman who was retiring. She was head of the lab at a hospital in Indiana. Anyway, she moves into this new house. They're all excited to be there. It's a man-made lake. It's going to be a peaceful place for her to do her cooking and baking and reading. And as she's sitting at the dining room table, looking out over the lake, just enjoying it. And she's a voracious reader. And she was enjoying her reading while I'm unpacking boxes and putting stuff away. And she says to me, "Diane, I can't see. My vision's all blurry." We rushed her to the hospital, and it resolved. What it was, I guess, was a TIA. And I also had a friend that was driving, an older woman who was driving her big 150 pickup truck. And I visited her a couple times a month to make sure she was okay. And as we're driving, she was talking to me, and all of a sudden it became slurred speech.
Uh-oh.
And I was like, oh my God. And you're right. Neither one of them realized what was going on, except my mother-in-law knew she couldn't read, but she didn't correlate that it could be a stroke.
Or that it was an emergency.
Or it was emergency, yes. So here I am. I get my friend Charlotte, who was in her late 70s, early 80s. I said, "Charlotte, can you pull over?" And she was able to slow down to the point where I could take over. And I stopped, pulled over, I got out, moved her over, and took her right to the hospital.
Oh, good.
And she told me later she had several TIAs. Know what they were, trans-ischemic attacks, but they resolved before, so she ignored them. I'm like, ah.
Well, we'll definitely focus on some transient ischemic attacks because that is something that I really want people to understand the significance of as well. Because you're right, that's something that we can't just think, oh, it went away and it's never coming back. I'll finish the Be Fast real quick so that we go over all the signs, but those are great examples from real life of the speech change and the vision change out of nowhere, right? It just came on suddenly. So in Be Fast, F is for face. Some people get a facial droop on one side, or they'll have loss of sensation or tingling on one side of their face. A is for arms, where one arm is weaker than the other, or there's a loss of sensation on one side. And a sudden onset of one-sided weakness is a pretty clear sign of a big stroke. Then S, as you mentioned, is for speech, and it could be slurred speech, or they might be saying words very clearly, but it's like what we call a word salad, where those
Yes.
words don't work together at all. And they don't even know that's what's happening. They're like, why do these people not understand me?
Yeah.
Or they don't understand what is being said to them. It's all like, wah, 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 wah. And they're like, why is no one else able to talk right now?
Yep.
And then T is for time, where time saved is brain saved. Or it could be for terrible headache. There's a type of hemorrhagic stroke called the subarachnoid hemorrhage, and the telltale sign of that is a thunderclap headache where it comes on suddenly and it's followed by the worst headache of your life. Even if you're a chronic migraine sufferer, this would be new and different. And for any of these stroke signs, you want to call 911 so that they can get you to the level of care hospital that can treat you appropriately. So,
can you explain why acting fast is important during a stroke? Because people just don't seem to see urgency in that.
And before 1995, if you had a stroke, then it was, sucks to be you. We're going to roll you over in the corner and I'm sorry, you're stuck that way. We didn't have a way to reverse it before that. But in 1995, the NIH did a trial using alteplase, which is a clot-busting drug that can be given IV, and it can break up the clot in that ischemic stroke, restoring blood flow and restoring all that function. And I've seen this happen over and over again. I've worked with stroke patients for over 12 years now, and to see the parts of their body come back online, essentially. Sometimes it's like a switch is flipped, and sometimes it's more gradual. And yeah, every now and then it doesn't work like that. But we have the potential to reverse it with that or a neurosurgical procedure if it's caught super quickly. The IV medication's only available within 4 hours or so after the first sign of the stroke is coming on. Then they can do the neurosurgical intervention up around till about 24 hours, depending on what the brain scan looks like. But it's not something to go to sleep on and wait till the next day to see if it's better, because by then it may not be reversible.
Yeah. What does the stroke treatment process look like from emergency response to hospital care?
So as far as if you call 911, what to expect?
Yeah, what would could they expect?
In a good scenario, I would expect the EMS team to come to the scene, do an assessment, and see if what you are experiencing is stroke-like, and that will help them decide where best to take you. They should also be taking your blood sugar to see if, like we talked about, you're showing stroke-like symptoms due to some other imbalance that you're having. They'll also take your blood pressure, and usually if you're having a stroke, it'll be a high blood pressure. They will also start doing some lab works to check other things. They'll try to find out what your medication history is. It's very helpful to know if you're on a blood thinner. People who are on a blood thinner are not able to get the IV medication, usually. And things like that. Once they get to the ER, they should be rushed to get a brain scan or two. And then if they're eligible for that neurosurgical procedure, they may have to go to the OR for that intervention. And then if they get the IV medication or that intervention, they'll need to spend at least a day in the hospital monitoring. And then they'll need an assessment from physical, occupational, and speech therapy to see if their stroke symptoms require more of that rehabilitation to get their function back as much as possible.
You were saying that the ischemic strokes are the most common. And I'd like you to address that more and talk about what the signs and symptoms are and the TIAs, what that means. Because people think it's a mini stroke and it's nothing when they don't realize that it's something bad.
In the circles I run in, we don't even use the term mini stroke because you either had a stroke or you didn't, as far as there's either evidence of brain damage on the scan that was done, either CT or MRI, or there is no visible evidence on the brain scan of dead tissue, which would be the stroke, or blood in the brain in the case of the hemorrhagic stroke. A TIA is a transient ischemic attack. And the word transient mean it goes away.
Yes.
So with those, all of the symptoms that brought you into the hospital go away. All those be fast symptoms. Your balance comes back, your vision comes back, your face isn't droopy, your arms aren't weak or tingly, your speech is no longer slurred, and you don't have a headache. It went away. And if that's the case, that's wonderful. Except if you have a TIA, then you're at a very high risk of having a stroke probably within the next month or so, because whatever caused it to start hasn't been found or addressed. So you have to see this as a warning, not as oh, I'm so lucky it's over. This is your second chance to find out the cause and do everything possible to protect against it. So that's when you find out, do I have high blood pressure? Is this a problem I have had and I didn't know? A lot of people don't go to the doctor regularly, so they may not know they have high blood sugar. They may not know if they have high cholesterol. Every now and then we get in marathon runners or athletes who are fit and they eat healthy, but maybe they have high cholesterol due to genetics and they didn't even know. Or they have weird blood vessels, or they have a hole in their heart, or someone has sleep apnea and they didn't know. Sleep apnea is a huge risk factor for stroke that a lot of people have, whether or not they snore. And so we go through this process of elimination in the hospital of what are all the potential causes of stroke and what of those do you have. So there's a lot of testing that can involve blood work. It can involve tests of your heart, looking for that hole in the heart called a PFO, looking for irregular rhythms like atrial fibrillation, for example, looking for clots in other part of the body like your legs or that could have broken off and traveled to your brain. It really is not all over when you leave the ER and go to be admitted into the room, or even when you go home, because some of those things take a while to result, or you might need to wear a heart monitor at home to look for those. And doing that follow-up care is going to be really important to making sure that you find the right plan for prevention that works for your specific situation.
Charlotte, my friend, was a diabetic and had high blood pressure, and she would cheat and use extra insulin when she wanted to eat badly.
Oh.
And I learned after this TIA that I took her to the hospital with, she had probably 4 or 5 over the past year. And there were several times where she called the 911, but by the time they got there, it had resolved. But she never followed up with the doctor. And I felt bad when I learned that, because maybe this could have been prevented, the massive stroke that she had that put her in a nursing home for the rest of her years. It's just really tough.
Yeah, and 80% of strokes are preventable, but I think a lot of the time that can result in a stigma around it because people are like, oh, they didn't make healthy life choices, but they're not all actually preventable. We just have to try.
Exactly.
We can't assume that it's somebody's fault if they had a stroke. You can only do...
Oh, it absolutely. It's nobody's fault. It's just some people have defects in their brain, in their wiring, or not the wiring, but the blood flow to the brain, and they're weak and they burst. That's why they have these... Isn't that why a transient ischemic attack is a small little bleed that resolves quickly? No, that tell me.
No, so a transient ischemic attack is usually it can be when blood vessels get kinked off, like a hose is kinked off due to stenosis. Yes. So they'll check the carotid arteries and see if there's stenosis in the arteries and see if they need a stent and keep them from getting occluded by cholesterol deposits in there as well. The hardening of the arteries, basically everything you can do to prevent a heart attack, you can do also applies to preventing a stroke. It's the same vascular system. It's just that the symptoms are different. So just like you would have a heart attack if a blood vessel in the heart is blocked, then this is like a blood vessel in the brain is blocked. And so they might go in with neurosurgery and pull the clot out and put in a stent to hold that open to keep it from collapsing again.
Interesting.
And yeah, so if you have blood in the brain, it's not usually transient. Actually, those typically have a more arduous recovery.
Gotcha. So are there specific diet or exercise or lifestyle changes you would recommend for reducing stroke risk?
Oh, yeah, definitely. The Mediterranean diet is really the only diet that's been studied and proven effective at being neuroprotective as well as preventing heart disease and stroke. So the Mediterranean diet involves having healthy fats, not high in saturated fat. So choosing fish instead of beef, for example, having low sodium, eating fresh fruits and vegetables, eating sugar and things like that. There's great examples of that on stroke.org, as well as if you Google the Mediterranean diet, anything that fits in there should be good unless you have allergies.
Now, smoking is something you definitely would avoid, right? Vaping with nicotine, those are all.
It's not just the inhaling of cigarettes. If you vape, that's not better for your stroke risk.
Yes.
And another thing that I need to layer on top of that for women that's different is taking hormonal birth control that contains estrogen can increase stroke risk. And if you are using nicotine as well, that's like a double whammy. That's really dangerous. And we've seen really bad results in younger women who are on that form of birth control. And that's obviously not talking about like topical things you would use in menopause necessarily.
Right.
That we're talking about systemic, more prolonged estrogen for birth control purposes. So if you are of childbearing age and you need some kind of prevention of pregnancy, definitely talk to your gynecologist or primary care provider about what you can use that would not increase your stroke risk.
And that's a good point you're making, that it's not just in old people that this happens.
No, it's more and more in young people. And actually, stroke is in one of the top 10 killers of children.
I did not know that at all.
And that's more genetic. They have different causes.
Yes.
But it still happens.
I had a young man when I was at Sister Kenny that was living in a nursing home, and he had 20 strokes and he was only 18.
Oh, no.
And he could communicate very simply, maybe smile, grimace, smile, that kind of thing, or shake his head up and down. But he had all kinds of physical mobility issues, speech issues and stuff. And that always stuck with me, that here's this handsome young man and he had a history of strokes that were amazing. And it wasn't anything to do with his lifestyle. It was his genetics that brought him to that nursing home. It was sad. His parents really had a hard time with that one. In fact, they always worried about their other siblings, but his siblings, he was the oldest and the first. They were brave to have another child. They had two others and they were fine, but I don't know. I lost track of them. So I don't know if the kids had strokes as they got into teenagers and older adults. But yeah, that was really something I struggled with when I worked at Sister Kenny, because I was shocked in young women coming in with strokes because of birth control. Because our youth think that they're invincible and it's not going to happen to them, but they don't know until it does. So I appreciate you bringing up that it does happen in younger people.
Yeah. And especially as the majority of adults of all ages are obese and overweight, that's stress on the body. It applies to your whole body. It increases your risk for stroke, and physical activity is going to be really important. And since we don't have to walk 2 miles to go get water, we have to make ourselves move sometimes. Yeah. A lot of us have jobs that require sitting. For example, something I did was I got a standing desk, and I've tried to do more moving at work, but even it's hard to get 6,000 to 10,000 steps a day, which is what a lot of people recommend, that you have a goal of movement and try to just increase your movement, even if it's doing normal household activities. A lot of the time we have this inertia problem where if we're sitting, we don't want to get up, right? So we got to make ourselves move. Sometimes I try to park further away. My husband prefers to go to the gym. I prefer to park further away from the church parking lot. I'm like, look, I'm going to get some more steps this way. Then now I have to go to the gym.
I park way far away because I do the same thing. I used to go to the gym, but because of chronic pain, it's hard for me I can't lift weights like I used to, and I can't run anymore. I walk on the beach and I park far away. I try to get my steps in that way. And that's the other thing people don't understand, that you don't have to do 30 minutes at a time. It's okay to do 10 minutes at a time. And 3 or 4 times a day is better for you than nothing at all.
Yeah.
I was astonished to hear the statistics for our youth. Our kids between the ages of 4 and 18 are having obesity problems to the degree we've never seen before. And they're developing type 2 diabetes at such early ages. That's a preventable disease. And I wonder
and actually, we've seen some evidence that type 1 diabetes is preventable as well. The rotavirus vaccine ended up preventing type 1 diabetes to develop in children.
Wow.
Apparently that was damaging their pancreas, so they couldn't make insulin.
Wow.
That was like an accidental finding after they rolled that out. I was listening to Dr. Paul Offit talk about that because he was one of the developers of it. And they were trying to prevent children from dying of dehydration from this GI virus or whatever. Just come to find out, they were like, why is type 1 diabetes dropping off? And
that's fascinating.
Isn't that amazing? So
I just heard something about that today, just that it was preventable. I did. It was some news clip when I was driving today, and I thought, really? But they didn't say how or why. They just said that it's possible that they've discovered that type 1 diabetes may be reversible. And I thought, oh my Lord, that's amazing.
I don't know. I think that might be different too for people who already have type 1 diabetes. I'm not sure what you were listening to, but it is encouraging to know there's a way to prevent it initially if you get But as far as type 2 diabetes, yes, it's preventable, diet and exercise related. If we as adults are moving more, then we can encourage our children to move more and lead by example. So for instance, after this, I'm going to go for a walk with my dog and my daughter, and we're going to move together. And I was like, we can watch a movie together after we walk together, and use that as an opportunity for connection as well, which loneliness and stress and things like that, those contribute to stroke risk as well. Yeah. And you've got to have hope, and you need to have connection with other people. Yeah. And a lot of times after a stroke, the stroke survivor, as well as the caregiver, feel really isolated. Yeah. And so for their own mental health as well as their physical health, it's really important that they stay in community with people. And so I think it's very important that people understand that we can't just leave them to themselves. You need to check on people. So if you know someone who's had a stroke or someone who's caring for someone who had a stroke, they may not want to ask for help. So they might need you to just be a friend to them.
Yeah. And the other thing is they have such extraordinary fatigue. Stroke victim survivors, they have extraordinary fatigue. And one of the things as a rehab nurse, you're supposed to enable them to do as much as they can for themselves for as long as they can, and then you step in. And I find many caregivers, and this is a topic for another day, but caregivers need to be patient and allow them to do, like, if struggle to eat or struggle to dress to a point. And because you don't want to do everything, but most caregivers are, hurry up, let's get it done and get it over with. But it denies the patient or their loved one, the stroke survivor, the ability to try to change and improve their body in some way. Because it is multiple repetition over and over again that brings success.
And you're right, they need to be able to do as much as they can, but with that fatigue and, like you discussed, you have to allow them extra time to complete a task. So if you need to be out the door at a certain time and normally you would have 30 minutes to get ready, and they want to try to dress themselves, lay their clothes out or whatever, like an extra 30 minutes early. and
Yeah.
just build in that extra time and then allow breaks for rest. If you're going to be traveling and normally you would do 3 activities a day when you're exploring a new city, you might need to just plan to do 1 and then wait and see if you have energy for a second activity.
Exactly.
But you can still do things and encourage them to do things.
Yes.
Just
And
have
patience with the caregiver is the key. They just have to show kindness and patience. And it's so hard because so many caregivers feel time overwhelmed. They just, it's just hurry up and get it done. I've got things to do too. And they really need to be patient, and it's hard. But like you said, plan your day. If you need to get to the doctors in the morning, plan an extra 30 minutes or an hour beforehand to get ready instead of rushing at the normal time to get out the door.
Right. And so there are things like that you learn from experience, right? And so you might not realize that it's going to take you extra time. But once you do realize what your new limits are, then you can make those adjustments.
And the other thing I want to address is stroke recovery is an ongoing thing after.
Neuroplasticity is a beautiful thing, isn't it?
Yes, it is. Yes, it is. And so even if I did interview with Dr. Ken Monahan.
Oh, good.
I did the other day on neuroplasticity, and he's amazing and talks about stroke recovery at home and about tele-rehab and stuff. And I can see where it's going to be. He lets people know recovery is long and it can be ongoing for years later, but you can still make improvements. And I think a lot of stroke survivors think this is all there is.
And they're told that. The majority of medical professionals for the longest time, the word on the street and the expectation was, however you are 6 months to a year after a stroke is your new normal. This is how you can expect to be. But people can continue making progress 20 years later. They need to not give up. But they need to be informed that they can have hope in order to not give up, because they're just responding to what they've been told is that they should not expect to get better. And then they're like, then why try?
Why try? Yeah.
Yeah. So letting people know that if you continue doing what you learned in therapy and work towards it, not all insurances will cover as much therapy as some people need. That's why there's things like vocational rehab. So if you're not able to do the job you could do before, your state vocational rehab office might be able to help you get the physical, occupational, or speech therapy you need to work a different job where you don't have to be on disability, where you can still get out and do things in the world and feel like you're making a difference and accomplishing something. So there are support services like that. And anyone who works in stroke now knows about neuroplasticity and about this potential for recovery, but it is not common knowledge. So if you're seeing a primary care doctor and they're not aware of it, it's not completely their fault. They aren't in that wheelhouse, right?
Yeah.
As we learn, we can grow and expand our knowledge.
Yeah. It's the same in dementia care. The doctors don't know what they don't know. And we as caregivers and nurses need to advocate for our loved ones. One of the things that Dr. Ken made a reference to is he says, take a video of whatever part of the body you're working on. And he goes, take a short video, just 20 seconds, and then keep a library of it and do it once a week. And he was talking about how even little itty bitty small improvements are a success.
Yes. And then when you can see that, that continues to reinforce and give you hope that you can have that incremental improvement. It might be, but it's still possible. And then from 1 month to the next, or let alone 1 year to the next, it can be a huge improvement.
It can be,
There are other developments like vagus nerve stimulators that can repair people's ability to swallow or give them their arm movements back. So look up things like that are possible as well.
You've worked with so many survivors. Can you tell me about one inspiring story that still stays with you?
Just one.
I know. I'm thinking like, oh, I know so many myself.
One inspiring story. Something that made me really happy the other day. I work on another podcast called Stronger After Stroke, and in that one, I interview experts as well as stroke survivors about their experience. And I got to interview a therapist talking through some emotional coping mechanisms after a stroke, dealing with anxiety and depression, which is highly normal after a stroke. It means you understand something scary happened and you're trying to deal with that. But a lot of people go home and can't sleep. They're so afraid that they won't wake up the next day, or that they'll wake up and half their body won't work again. And that can be really debilitating. And the people around them may not understand. So I had a woman who called me and she said that she felt like a crazy person because she was too afraid to do anything and now deliriously tired from missing multiple nights of sleep. And she felt like her husband thought she was going crazy because she would tell him how she was so afraid. And he was like, but that's over. Just get over it. Just move on. And he wanted to help her, but he didn't know the words to say.
Yes.
So I shared her this episode about emotional coping after stroke, and she listened to it with her husband. And after that, when she started having those feelings again, he was able to talk her through that emotional coping strategy. And so on the one hand, that helped their relationship because she felt validated by him, that he understood her and that she wasn't going crazy, and that this was a normal way to feel. And then she was able to sleep and feel even better.
I saw that in acute rehab even.
Yes.
They didn't want to sleep because they were afraid that if they did, they wake up and the body would be worse. I've seen that many times. Yeah. I appreciate hearing that story because people don't know what they don't know. And there's fear is real. It is real. And it's a normal response.
It's based on the reality of their experience.
Yeah, experience.
And so what was so beautiful to me about that was how they did it together.
Yes.
How it was the beauty of the relationship of the stroke survivor and her caregiver. He was able to give her care because he was able to learn how.
And God bless him for willing to do that.
Oh, yeah. Yeah.
Because that's hard for him too.
Oh, for sure. Yeah. For sure. But I'm sure most people want their loved ones to feel better and want to do anything they can. They just don't know where to find the answers, right?
Yeah, and I think, and I know people get upset when I say this, but a lot of men feel challenged sharing emotions.
Oh, yes.
It's my age. I can say it and get away with it. I've lived it.
It's true.
It is true. It's just the nature of the environment when we were growing up, especially the older, us baby boomers. Men didn't talk about their feelings. They just kept everything. Yeah, we're cool. Okay. Yeah. Okay. And it's so touching to me because I see so many spouses taking care of their wives, the male spouse taking care of wives, and the loving care. It's true love, is commitment, and the way they're willing to do things, and they do talk, and they do, and it's lovely. I really appreciate that. And I think that people that have that kind of love are very blessed because it's hard to find in today's world.
Oh, yeah. It's probably hard to find anytime. Yeah.
Yes. Trust me, I know. What message do you want to give caregivers and families to take away when it comes to stroke awareness and brain health?
Definitely be fast. Know what be fast stands for. Find out where you stand, whether you are a stroke survivor or you are caring for a stroke survivor. It's not just the person who has experienced a stroke that needs to be aware of their risk factors, because if you are caring for someone else, that stress on you increases your own risk. So knowing where you're at and not just focusing on, I got to take them to their 10 doctor appointments, so I'm not going to go to my one.
Yeah.
I'll make sure you're eating right and sleeping and getting some rest. If you need respite care, reach out for that. There are some state resources, depending on your state, for respite care assistance. So find out what your state offers. You can call the American Heart Association's Stroke Warm Line, and they can help identify other national resources available. So if you go to stroke.org, there's a lot of information there on what stroke is, how it works, and the support that's available, whether it's support groups or professional assistance as well.
And I want to thank you for making that point, because the statistics for the family caregiver are very grim.
Yes.
63% of them become seriously ill,
Yes,
or die even before the person they are caring for passes. And it's due to lack of care, the stress, all those things that a lot of them do end up having strokes, and they're not able to continue to provide that care.
or developing cognitive impairment.
Yes. Rosa, thank you so much for your time today. I just really appreciate it. It's going to be Stroke Awareness Month in October, and I want to make this part of the playlist for my clients, for my listeners out there. Tell people how they can reach you.
Yeah, so I am available on LinkedIn. Also, if you go to my website, nurserosaspeaks.com, that has links to all 4 podcasts that I work on, which does include one that's about stroke and one that's about other health-related things, as well as Aging Like a Pro that I do for the University of Miami, which is all about brain health. And that's not just stroke specific. So that's nurserosaspeaks.com.
Awesome. Thank you so much. To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day, because you are worth it.